Today, a major first step toward restoring the healthcare access to people who live in the Cuthbert area. United States Senator Jon Ossoff of Georgia announced $11.8 million is going toward the Randolph County healthcare.
WALB News 10's Quinlan Parker reports what this means for Cuthbert and breaks down the health disparities rural Americans face.
These federal funds would not be in a position to have a chance to reopen the hospital.
The COVID-19 pandemic hit many hospitals hard, specifically in Randolph County, when they had to shut their doors to the community it served for over half a century.
There are several contiguous counties around us that have no hospital either, so our facility was a hub for several surrounding counties.
The idea that something like a heart attack or a stroke would require a 2-hour drive to the nearest emergency room, that's something that's deeply disturbing.
About 15% of the U.S. population are more likely to die from heart disease, cancer, unintentional injury, chronic lower respiratory disease, and stroke. Now, residents in rural areas tend to be older and sicker. Children in rural areas, they also deal with more mental, behavioral, and developmental disorders than their urban counterparts. The CDC recommended addressing those health disparities in rural areas, such as being screened for high blood pressure to curb risks of heart disease and stroke, encourage physical activity alongside eating healthier, and more support for children, especially those facing mental or behavioral disorders.
But there is a long and uncertain road ahead, as this funding is just the foundation to restoring access to emergency health care to Cuthbert families.
There are many steps remaining, local, state, and federal, to get this done. But without this initial historic $11.8 million investment in Randolph County healthcare, we would not be in a position to continue this effort.
But for now, as far as the next steps,
The funds will be used in equipment and to remodel a facility that is in bad need of upgrade. So depending on the model that is sustainable, the money would be used for equipment and for remodeling the facility.
there isn't a timeline as of yet for when work will start to reopen the hospital, but we'll keep you posted as we learn more. Quinlan Parker, WALB, your hometown news source.